Good afternoon, everyone. I hope that all are doing well. This is Dr. Sam Fleishman. I'm Chief Medical Officer at Caper Valley Health, and I'm here to talk to you today around diabetes and sleep disorders. I hope you all are doing well and healthy and well. As you know, this is National Diabetes Month, the month of November. And although we can't be together this year like we typically are every year to talk about Diabetes Month and the various things that affect all of you that have diabetes, we are here to at least present some of these recordings with you. So I'm going to at least do a little bit of a presentation today for you all to hopefully you appreciate this education. Again, my background, I am the Chief Medical Officer at Caper Valley Health System. I'm also a sleep medicine specialist and a psychiatrist. I've been here, was born and raised in this community, but have been practicing sleep medicine and psychiatry for the last 25 years. So just to go into this discussion, I think it's important that all of you know that have diabetes, and frankly everybody in America, that sleep is extremely important to your health. And it's even more important if you are suffering with diabetes. Just the backdrop in our country, our population is significantly sleep deprived. You could say it's an epidemic. Up to 19% of adults in the U.S. don't get enough sleep on a daily basis. 40% of adults report falling asleep during the day without meaning to at least once a month. And up to 50 to 70 million Americans have sleep disorders, sleep or medical disorders. And again, a lot of these disorders and sleep deficiency has been tightly linked to heart disease, kidney disease, high blood pressure, diabetes, stroke, obesity, and depression. So again, we know that when people sleep less, it's linked to lots of healthcare issues, and we have essentially an epidemic of sleep deficiency. And as I mentioned before, many of us go to work significantly sleep deprived, where we should be home sleeping before we get there and be well refreshed to do our jobs. As I've often said, ever since Thomas Edison invented the light bulb and we figured out ways to manipulate our environments to stay up longer and longer and to work harder and harder, or to stay up all night and to work all day and night, it seems that we certainly, or even our Americans, especially with the capitalism that we live in and the idea of the early bird gets the worm and staying up longer and longer and work harder and harder, many of us become more and more sleep deprived and get overstimulated. So we do live in this epidemic of sleep deprived Americans. So what happens to us when we become sleep deprived? What effects does it have on human beings? And we know they're significant, and so we really want to see what the cost is and how it has an impact on all of us. So what are the effects of sleep deficiency? And certainly when we are sleep deprived, we cannot attend to things as well. We don't stay as focused. And if we don't attend and focus to what information is coming into us or the things around us, we can't understand or have good cognition of what is going on. So it has significant impacts on attention and cognition. Our performance levels drop, not only from a cognitive perspective as far as our ability to remember things, calculate, understand ideas or information or read, but also our physical performance also deteriorates with sleep deficiency. We often can't perceive things. We can't elucidate, understand things as well, not only from a learning perspective, but even like when you're driving and you're looking down the road when you're more sleep deprived, you can't see things as well and you misperceive. Also, and importantly for those with diabetes, as well as we have changes in our hormone levels. There's two hormones specifically, one named leptin, which is related to satiety, and ghrelin, your appetite hormone levels. They also are altered as a result of sleep deficiency, which we'll talk about in the next couple later on in this presentation. And also insulin resistance. Insulin resistance goes up with increasing sleep deprivation. So you actually cannot, your blood sugars can go up or be harder to control when you are more sleep deprived. So this is just to reinforce that only during the work week, we up to 28% of us only get 8 hours or more, or get 8 or more hours of sleep. A lot of people only get 5.5 to 6 hours of sleep during the work week, and you can see that this group is at the the coffee. And now you get the Keurig as opposed to maybe the coffee maker there to get that. Caffeine is like one of the top two commodities traded in the world. So coffee is really, or I should say coffee is one of the top two commodities traded in the world. So caffeine is a big deal to all of us, and it's because we're also. Um, so what are the relationships that I wanted to bring up about sleep deprivation and sleep restriction and weight gain and diabetes? As these are all big things for all of you that have diabetes. We know that as you become more overweight, you're more likely to develop type 2 diabetes. And also it has an impact on your diabetes, right? The more overweight you become, the worse your diabetes gets. And so how does this work? How does sleep have an impact on that? So what I want to make you understand is that sleep clearly has an effect on your glucose metabolism, your appetite, and your energy expenditure. And these are maybe evolutionary strategies that we have that are now maybe helping drive these pathological states. And I'll try to, but what I mean by that is the more sleep deprived we get, I guess if we were in our day of the caveman, my guess is that would be a vulnerable state. And you likely were in that vulnerable state, that it's important that if you're in a vulnerable state that you protect yourself, and that would mean by eating as much food as you can and expending as little energy as you can until you can get into a better situation. So let's look at what sleep restriction does. So what we do know is that this is the way that your food, that you have food intake are kind of regulated by your brain and these hormones. And what you can see is that our metabolism is kind of this seesaw you see to the right of the brain here. You have energy expenditure on top of the seesaw. On one side you have expenditure, on the other side you have intake, and in the middle there you have this energy balance, right? And so our goal is that typically on a daily basis is that you want to ideally have a balance, right, where you take in as many calories as you burn every day, and that kind of keeps you neutral. Unless you're trying to lose weight, then you want to burn more energy, expend more energy, and intake less if you want to do that. And certainly, if you take in more than you burn, then you gain weight. And so, what has an impact or influences that balance, that energy balance on the right, are these things down below. Is your brain has these hormones that are out of that adipose tissue, is your fat cells, and what hormones secreted from your fat cells is this hormone called leptin, and leptin is a satiety hormone. So when you're full, or if you've got all the food that you need, then leptin is secreted by your fat cells and goes into the bloodstream and gets to your brain and tells your brain, hey, we're full, we're good, we don't need to eat anymore. And so we call that our satiety hormone. On the far right, you see the stomach, and in the stomach, when the stomach is empty, we have a ghrelin hormone, and that ghrelin hormone sends a signal to the brain saying, hey, we're hungry. And so when the ghrelin levels go up, that's telling you that it's time to eat. And then, of course, from the pancreas, we have insulin. And what insulin's job is that when you have lots of sugar in the bloodstream, insulin's job is to take that sugar and bring it into the cells to lower your blood sugar levels and to get that blood sugar used. Then, of course, the idea is to take that glucose and use that for energy to burn and to do the functions that you need to do to function. So this is kind of the hormones that play a role and have an impact on the control of your food intake. Leptin saying you to stop eating so much, ghrelin telling you to eat more, and insulin dealing with the blood sugar and glucose. What we see here is a nice study to show you what happens to people when they become sleep deprived. This is a table that shows a change in daytime levels when people have been deprived of from 10-hour-a-day sleep cycles to 4-hour bedtimes in 12 healthy subjects. So essentially, they were curtailed in sleep from 10 hours to 4 hours after 2 days, and they measured these levels in these individuals. And what you can see is that there was an 18% drop in the measure of their leptin hormones during the sleep-deprived state. Their ghrelin hormones, the appetite hormones, went up by 28%, almost 30%. Their hunger, their perceived hunger, went up by almost 24%. Their global appetite went up by 23%, and appetite for carbohydrate, they carbohydrate crave by 30%, and appetite for other foods went up by 18%. So clearly, sleep deprivation has an impact on your appetite and hunger states, and so we know this. So this is a good example of what sleep deprivation. And just to kind of put it in a more clear tables here, sleep loss can alter your glucose metabolism. It upregulates your appetite regulation and also lowers your energy expenditure. And so so when you get altered glucose metabolism, as you go down in that first column, you can see that also can have an impact on insulin resistance. If you upregulate your appetite and you're not sleeping as well, you've got more time now to eat and to go after and get food, which then causes this weight gain. And also, when you have more sleep loss, it actually affects your metabolism. It lowers your metabolism. So now you're up more, you're eating more, and your metabolic rate has dropped, which means you're not burning calories as much as you normally would, which then just causes more weight gain and more insulin resistance, which then drives this lower left corner of diabetes risk. So again, you can see how all these significant role. And again, just to give you another table to let you know what happens with sleep deprivation, increased hunger, increased opportunity to eat. It alters your metabolism or thermoregulation. It also can increase fatigue. It also has increases in your stress hormones, which are catecholamines and cortisol. And again, these things result in increased caloric intake, reduced energy expenditure, and also reduction in state of alertness and concentration as a result of these hormones, which then can lead to obesity and further down to potential increases in your diabetes and insulin resistance. So in summary, you snooze, you lose. So we really want you to try to sleep more. And people that have, and this is just more data that supports that, again, that people who tend to sleep 8 hours a night compared to those who sleep 5 hours a night, who only sleep 5 hours a night, their BMI was increased by 3.6%. Their leptin levels, their satiety hormone levels were down by 15.5%, and ghrelin levels, or appetite hormones, were up by as much as 15%. So if you sleep up to 8 hours, your likelihood of losing weight and maybe stable and maybe normalizing these leptin and ghrelin levels can improve. So let me just shift here and talk a little bit about one of the common sleep disorders with folks with diabetes. A lot of people with diabetes do have insomnia symptoms, but one of the comorbid sleep disorders, obstructive, very common in diabetes, and I want to make sure that everyone out there is aware of this. I talk about it regularly. But obstructive sleep apnea, it has an independent association with elevated blood sugars. It's also independently associated with insulin resistance and often comorbid with diabetes, as well as hypertension and cardiovascular disease. So often these four things come together in a metabolic type of syndrome where you have diabetes, obstructive sleep apnea, hypertension, and cardiovascular disease, which really have very significant effects on your your quality of life, but also how long you live. So significant morbidity and mortality that can occur with these clusters. So what is obstructive sleep apnea? I'm sure many of you have heard this before, but obstructive sleep apnea is this upper airway obstruction that occurs while you're sleeping. It's associated with loud, persistent snoring at night, and your bed partners often are probably complaining about it, and it's also, and often they hear these long pauses between the snores, which is often when they're having these obstructive events, and usually these people have excessive daytime sleepiness or fatigue or tiredness during the day, and sometimes reports of just choking, gasping for air during sleep as well. This just kind of shows you what the airway looks like. And again, the sleep problems are common and treatable. The eye problem is the snoring and the sleep apnea. What you see here in this area right here is where the obstruction occurs, back here in this post-airway space. This is the back of the tongue and the roof of the mouth coming together with the back of the throat. And it's here where that obstruction occurs. And when air moves through there and it flaps together and reverberates, that's the snoring sound that you hear. And so that's where the obstruction. So there are two different types of obstructions that we look at when people have sleep apnea, and one is an apnea, where there's total cessation or they don't move any airflow for 10 seconds or more while they're sleeping, and that's called an apneic event or apnea. And then we have what are called hypopneas, and hypopneas are partial obstructions. We have a decreased airflow for 10 seconds or more during sleep with at least a 4% drop in oxygen saturation associated with those events. And those are called hypopneas. And we add up those events to come up with a number of events to determine the severity of your sleep apnea. So as mentioned before, here are the clinical features associated with sleep apnea. It's typically in people over the age of 45. It's usually middle-aged or older men especially, but women also can develop these symptoms and get more common, especially after menopause. And the symptoms, as we mentioned earlier, are loud and habitual snoring, witnessed apnea or apneic episodes at night, daytime sleepiness, frequent awakenings across the night and unrestful sleep, people waking up choking or gasping for air, awakening with morning headaches is often a common symptom, waking up often to use the restroom at night, or nocturia or nocturnal, having to use the restroom often more than 2 times a night. And people often may kick in their sleep or wake or twitch in their sleep. And again, the exam findings, a lot of people are overweight. Most people are overweight that have this problem, but not everyone. BMI of greater than 25 is suggesting of obesity. A neck circumference in men greater than 17 inches, and women certainly greater than 16 inches. And again, we talked about kind of having a rounder face and thicker neck. And also people that have what we call a tight post-airway space are also notorious for having this kind of problem and obstructions. As far as adverse outcomes associated with sleep apnea, again, we talked about the daytime sleepiness, cognitive and neuropsychological functioning impairment in those areas. Quality of life goes down. People may have issues operating motor vehicles and certainly can fall asleep behind the wheel. And again, all the cardiovascular issues we talked about before, hypertension or high blood pressure, heart arrhythmias, Brady and tachyarrhythmias, atrial fibrillation, coronary artery disease, heart disease, increased risk for strokes, which are cerebrovascular accidents, exacerbates congestive heart failure, cardiomyopathy, pulmonary hypertension, and again, increased overall mortality. And again, as I mentioned before, insulin resistance is a big deal as well. With it. And certainly has an impact on quality of life and can increase your morbidity and mortality. And if it goes untreated, sleep apnea associated with 33% mortality over 14 years compared to 7.7% mortality in people with no sleep apnea. So clearly, if you leave it untreated, it can certainly shorten your life. So what are the best treatments for sleep apnea? And again, ideally, if people could lose weight and they get closer to the ideal body weight, usually sleep apnea gets significantly better. But more commonly, people with diabetes that have sleep apnea often go on something called positive airway pressure, or CPAP. Surgery often is not curative, although sometimes we consider that. And sometimes we can use jaw positioning devices. But typically, if people have diabetes and other comorbidities, they're going to be on continuous positive airway pressure. And that is what this is. This is a CPAP machine. And what you see this person doing is wearing a CPAP mask over their nose that is to be tightly sealed over their nose and sometimes over their mouth. And we pressurize that air. So this is what CPAP therapy looks like. And essentially what we're doing in this slide is there's air coming from a CPAP machine. It's just air, and it's blowing air, and it's pressurizing the airway enough to keep this airway open, patent open, before it was closed. And this is keeping it open, like is what the CPAP is doing here. And so that's really the goal of PAP therapy. It's really not breathing for you. It's just splinting that airway open for you on the right side is what the airway. Sometimes we can use these oral devices to help with sleep apnea in milder cases, and sometimes dentists can help us make those. But typically with diabetes and more severe sleep apnea, the treatment's airway pressure therapy. So look, I've covered a lot with you today on sleep apnea, on diabetes and sleep. I do want to give you a couple of things that you can do overall to help your sleep and sleep health. So I'm going to jump into that. This is just a cartoon for you to hear about the people, the elephants are always hearing something downstairs and can't sleep. But things that you can do to improve your sleep in general is good sleep hygiene. What I mean by that is, certainly cigarettes and alcohol are not great things to use if you want to sleep well, especially close to bedtime. Alcohol will help you fall asleep, but doesn't help you stay asleep, and often can cause you to wake right back up a couple hours later. So having a couple drinks before bedtime is not good for helping improve your sleep. Cigarettes elevate your heart rate and blood pressure and temperature, and they don't help you. They only make you stay up longer. And caffeine as well. Drinking caffeine, after lunchtime probably is not the best choice for you if you want to help sleep better at night. So really want to try to eliminate these things as much as possible. We talk about not doing too many things in bed other than sleeping. If you're watching TV all night or leaving your TV on all night long, or watching the clock, or tossing and turning in bed, or working and eating meals in bed, those things are all not great. So we tell you to only use the bed for two things. That's sleep, and I guess you can guess the other is sex. But we don't want you doing anything more than that. So we want you to keep your TV off or put it on a timer when you go to bed at night. If you find yourself tossing and turning a lot in bed for 10 or 15 minutes, we want you to kind of maybe get out of bed for a little bit till you get drowsy, then get back into bed, because the more you toss and turn, you just get more frustrated and irritated. Then your bedroom becomes a place of frustration and irritation, and you won't sleep well there either. So we want you to kind of not, to get out of your bed if you're not sleeping very well until you get drowsy. And probably clock watching is not the best way to help you sleep. You probably just get more frustrated when you look at the clock at night. So set your alarm and turn your clock around, maybe a better option. And then lastly, daytime exercise is often a great way to improve your sleep. Even if you can't go for vigorous runs and your health may be limited, I do encourage you to get out, get some activity, get early morning sun, keep your room nice and dark at night, and eliminate to do those things. So activity during the day, staying active during the day, not napping much during the day, and then keeping your room dark at night is important. And again, this is just to talk about your internal clock. Your brain entrains well to light, and so you want to get early morning sun to let your brain know that, hey, it's daytime. We tend to want to be awake when it's light outside and sleep when it's dark. And so you want to get the early morning sun, get out and go for a walk, or get outside in the early morning. And then at night when you want to go to bed, get your TV off, get your computers off, and make sure your bedroom is nice and dark. So look, this is kind of, again, a really quick summary of what things you can do to help yourself and to help with those with diabetes. There's a lot we could talk about around insomnia and other sleep disturbances and your medications and all the other issues that go along with diabetes that make your sleep so much harder. Many of you have peripheral neuropathy, have other issues that can maybe keep you up at night with chronic pain syndromes, and other things that we could certainly work on in the medical setting, but it kind of goes beyond this span. And if we had more time for questions and answers in real time, maybe next year we can do that. But I really hope that this guidance has, this has given you some guidance of things that you should look out for and talk to your providers about, and hopefully to help you in sleeping better overall as well. So again, I know this is brief. I know we can't be together this year. I'm wishing you all the best in the midst of this pandemic, and wishing us all together, being all together next November in 2021, where hopefully we can have more interchange and enjoy each other's company. So this is Dr. Sam Fleishman. I hope you've enjoyed this brief lecture on sleep and diabetes and overall sleep health. Take care. Bye-bye.